Well, good morning and good afternoon. Um, this is a nice little interesting day. I live in Oregon. Those that you don't know where I'm from. Yeah, I live in the Northwest. I live in Oregon. So we have supposedly 14 cases, they said, of the COVID-19, aka coronavirus, in our state. Now, our governor has issued a state of emergency, meaning for the next 30 to 60 days, we will have things like big, large gatherings, such like that, community buildings, schools. They're definitely going to be on a lockdown of some sort or closures for the time being. Um, Drink some coffee. I just woke up a little bit ago. Um, but yeah, I've been watching the news kind of constantly ever since then. Been watching um, pretty much what they've been saying about the disease, about the progression of it, and such like that. And what I'm concluding is you have to be vigilant. You have to be self-vigilant. You could try talking to your family. You could try talking to people that you love and console them about the situation. But unfortunately, here in America, I do have to say, in America, it's very hard to try to convince people to do things that they've A, never done, never tried, or B, just scared of doing just because of the sake of their well-being or others. Um, there's people that are going to be really offensive now that the allergy season is coming, so there's going to be a lot of people on the fence about, if I'm sick or not, or if my family is going to believe me on not being sick, or if I have the allergies. That's what's going on in people's heads already that I notice here, and also the fact of it's very hard in a state that's really progressive on um, homeopathic, natural homeopathic remedies, and the fact that we have a lot of mental disabled individuals here in this state, meaning there's a lot of people that aren't going to get the right information or take in the right information that they need to for this. It's a very common thing to wash your hands and use sanitizer and such just on a normal daily basis. But it's very hard here, definitely. Like I said, when you have so many people already self evaluating and say medicating and just a lot of self here, and which is good for sure. You don't want to rely on just the government or rely on hospitals or things like that. You want to be able to take care of yourself. Um, but I just have to say, if you try to have a meeting or a talk with friends or family or whoever that you love about the situation and they don't seem to want to grasp it, or they just seem that they're not paying attention to, or if you feel like they're not paying attention to you, the best you could do is just kind of get that information out there. Uh, and the best thing you could do is just try to stay vigilant yourself, try to stay self-aware of your surrounding, of your environment, where you're going, where you go from and to and fro. Uh, that's pretty much the, utmost importance. Also, the self-hygiene factor. If you're going to be out and about, if you're going to be conversing with people in large groups, just stay vigilant. Just know that there's a possibility that you can very well get this. It's not a laughing matter, it's a quite serious matter. When the amount of people that have gotten infected in the amount of time is definitely serious, even though the mortality rate on it is not as serious as other diseases that we've come across as humanity, and let's say, as humanity has come across. But it's definitely scary knowing that it's still early stages. People are figuring out there's more cases than they ever thought just because of the lack of testing kits out there. CDC, let's say, are expecting the number to be higher than normal just because of the fact of there's no there's shortage. There's a shortage, let's just say, of the kits and the testing kits that need to be for Americans, and the number of people that are getting tested. We need to see that number go higher than, let's say, 6 or 8 or 10. It needs to be thousands. It needs to be in the thousands, people getting tested. And unfortunately, for this country, I feel like we follow suit what other people believe in. We'll follow suit in that some other country will follow suit, and just really with anything, Americans really don't know how to think for themselves, unfortunately. And I'm American. I do have to say, fortunately, I definitely do not know how to think for myself, and I'm thinking, does this person, might have the best interest for me? Maybe, maybe not. I don't know. But then when you watch the rest of the world, you're like, why are we not paying attention, or why is anyone even trying to adopt what people are trying to say or do to prevent this from happening to someone else? Definitely a shocker to me. But best thing that you have to do, I'll just leave you with this, is take care of yourself. If you're going to be out and about, wash your hands. If you're going to be at work, use your sanitizer, use your things that you need to. Don't take anything lightly. If a coworker has allergies and you think that they're sick, just separate yourself from that person. Get the information that you need. If it's valid that the person has allergies, then okay, But if it's not valid and the person's just claiming that they have something that they don't know by a doctor or physician that has actually claimed that they have it, then you should probably keep your distance, and also document when you had to, just for the sake of, for work reasons, fear of being terminated. I would do that if that was the situation for me. But the situation for me is just, I'm going to watch for myself. I'm going to watch out for others. If I feel like someone is sick around me, I'm going to do my self-diligence and just try to make it another day, let's say, healthy. And all of you out there that are watching this video, or will watch this video, or watch videos like it, please just heed the message of take care of yourself, keep the loved ones safe, try to convince people if you can. You can't convince everybody. Most importantly, take care of yourself. Love you all. We'll get through this together. Peace. It's been real.